Hi there, my name is Vic Veer. I'm an ENT consultant working for the NHS in central London. And I want to do a very quick video because one of my patients reminded me today about this. I want to do a very quick video about how to put in nasal antibiotic cream. Now, there are two main types. There's something called Naseptin and Bactroban. Most people use Naseptin. I don't know why. It's just what we all use. And the only thing to be aware of when we're using Naseptin, which is an antibiotic cream for your nose after an operation, we tend to give it, or if you're having lots of nosebleeds. So Naseptin has peanut oil in it. So if you're allergic to peanuts, obviously don't use it. So, and we use it after people who bleed a lot from their nose, because often the area just here and just here called Little's bleeding area, where there's a confluence of lots of blood vessels that come to that area, they often bleed in that area because in the winter time, all the radiators are up, so there's lots of dry heat coming in that can crack these very small, very thin bit of skin in that area, which exposes these blood vessels. And also people do this sort of thing, and you can get localized infections in that area. So that's why Naseptin, which is basically an emollient, like a moisturizer, as well as an antibiotic together, work very well for this. The other reason why we give these Naseptin and Bactroban antibiotics is because after an operation, if you've got open wounds in your nose and you want to make sure it doesn't get infected, you can put these creams up your nose, and that helps you to stop you getting an infection and having infection of your septum, where you end up with a hole here or your nose collapsing, all those sorts of horrible things. So these nasal creams are really important. And how you put them in is thus. You put a little bit at the end of your finger, maybe a small petit pois, tiny little pea. And what I don't want you to do is stick it on a cotton bud and ram it up your nose, because all you'll do is cause a nosebleed or damage some of the lining of your nose, which after an operation is the last thing you need. So you put it at the end of your finger and put it like this and rub like this. You don't actually put your finger up your nose at all, so you don't need to worry about that at all. You just put it in like this, and again the other side. You might want to change fingers and do it like that on that side. And what you'll end up having is a big white sort of bit of cream up your nose, and you'll feel like my nose is blocked and this isn't working at all. And then all you do is with the same finger, just rub very gently from the outside of your nose like this. And some of it will come out. Don't worry about it. Just push it back in again and do the same thing again. You're not trying to massage it right to the back of your nose, because your nose will do that for you. If you remember, there are lots of tiny little microscopic hair cells that move bogey or snot from the front of your nose right to the back of your nose. And so these little things will work. So if you just put it at the front of your nose and just left it, after, maybe half an hour, maybe even 10 minutes, you might even start tasting it, because the little hair cells move all this stuff back. So you just have to get it to the entrance of your nose, and your nose will take over and do the rest of it for you. So please, whatever you do, don't start putting your finger up your nose, scratching things or picking things off. Try your very best just to put it at the entrance of your nose and rub very gently. These creams are often given on each side 4 times a day for about 2 weeks, particularly if you've had lots of nosebleeds, and it really helps that. Almost, I think 90-something% of nosebleeds get better just using this cream, rather than having to cauterize everything. And if you did get a cauterization where they chemically burn or heat burn these blood vessels inside your nose, using this cream afterwards you have to use this cream afterwards anyway, just to stop the open wound from getting infected. So it's very, very useful. I hope you found that useful. Do take care. Bye-bye.